Good afternoon. There's been a lot of discussion nationally in a lot of different jurisdictions about the timeline, the process, kind of where we are. There's been speculation about when things will change in terms of our posture. And today we want to convey the unequivocal and very clear message to San Diegans that in San Diego we are at the very beginning of our exposure and our engagement with the coronavirus. The situation that we face in San Diego will get worse and continue to get worse before it gets better. That means in the coming days and weeks we are going to see more positive cases, we're going to see more hospitalizations, and tragically we will see more deaths. The actions that we're taking will help mitigate that and will help make it less bad if we all come together and adhere to these measures. And it is really important. You know, a lot of individuals will say, well, I don't know anyone who has it. As Dr. McDonald has stated, the estimate of the number of positives we have based on limited testing is not a reflection of the true number of cases in the community. The estimates that's put out by our public health experts is the real number is probably 10 times greater than what we are reporting. So we are doing everything we can to flatten the curve. The stay-at-home orders, the physical distancing orders, the hygiene orders, the things we're doing will help us get through this, along with the efforts to increase the capacity and optimization and enhancement of our healthcare system, will help us work to fight valiantly to ensure the healthcare capacity system remains. But those will only be successful if each and every one of us truly commit ourselves to taking action and the actions that have been directed and ordered in order to slow the spread. And so I do think it is important that we need the public's continued commitment, we need the public's continued engagement, and we need you to understand that we are at the very beginning stages of this, and it is very serious, and we take it very seriously, and so we're asking for the public's continued help in the efforts to do this. We want to graphically share a couple slides. We'll go to the first one here on test cases. These are slides that we will begin updating on a regular basis in order to provide the public with more information. The first slide that you see in front of you represents the testing as been reported. The blue bar representing the total number of negative tests reported back to us per day. The orange line being the total number of positive tests reported to us by day. It is very important to note that for a long while, negative tests were not reported back to us. So not every test that was done in San Diego County is reported on this slide. These are just the results that were shared with us. We are getting much better cooperation amongst the entities that are testing, both the community testing as well as the labs that are testing, and we are hopeful and remain optimistic that we can continue to see an increase. But this slide represents from the early days when it was only CDC testing into a phase where we had limited capacity here locally, and now into a phase where we will continue to do this. But this slide does not represent any tests that are being processed. These are only ones that get reported back as negatives and positives. We do believe every positive test result has been reported back to us since the beginning of our involvement in this. We do not believe every negative test has been, but we will continue to update this with all of the information that we have available, and we will share that in real time. The second slide you'll see is a representation of the total number of new cases. The blue line, which you see on your slide, is the total cases on a day-by-day, starting with our first diagnosed case on March 7th to the current total on our website of 242. The orange bar represents the day-over-day total of new cases. And again, it is really important, and we want to remind everyone that the concept of exponential growth means you can see a rapid uptick. And as community spread continues, as better testing becomes available, as the severity and impact of this really takes hold, we fully expect these numbers will continue to increase, which is why we are asking the public today. If you wait until it appears that things are out of control to act, you have waited too long. Which is why in San Diego County we were one of the first jurisdictions to declare a public health emergency, one of the first jurisdictions to put in place physical distancing measures, and why to this day we continue to ask for the public's help and cooperation in adhering to these orders and these guidance in the best help we can preserve our healthcare system and get through it.